गुड इवनिंग दोस्तों, मेरी आवाज़ पीछे तक पहुंच रही है आप तक? ओके, ग्रेट. So let's start. Many of you, or most of you have seen my videos already, right? About 5 years back, I said that diabetes can be reversed in 3 days, 72 hours. But now many of you are testimonial to that. And 2 years back, I told that HIV do not exist. I have with me many patients, those are not taking any tablet, and whenever they check their HIV status, it comes to be negative. It was the tablet, thank you. It was the tablet which was keeping them HIV positive, not the virus itself. Today is one more day where we are going to see a new truth. It is cardiac arrest or heart attack, the better outcome at home than hospital. First of all, are the same heart attack and cardiac arrest? क्या ये दोनों एक हैं? पहली बात तो ये दो अलग अलग हैं. Heart attack is something else and cardiac arrest is something else. And कि अचानक हाथ यहाँ पे रखा, गिरा और उसके बाद कुछ देर बाद हॉस्पिटल का सीन and he is alive. Actually, this is not a heart attack. This is called cardiac arrest. Cardiac arrest. I'll tell you what is the difference. So, filmy heart attack, Hollywood or Bollywood, it is seen 67% of the time the patient remains alive. One research was done on all the movies, collecting all the movies together where there is a heart attack scene, actually cardiac arrest scene. And there it is seen that most of the time patient goes to the hospital and the next scene is patient revives. But the truth is, the reality is, if you suffer cardiac arrest, then the chances of revival is less than 10%. This means if 100 people suffer cardiac arrest, only 10 people will live and 90 are going to die. So, one contribution why all this confusion may be the Hollywood or Bollywood. So whatever we see, that's what we start believing. Patient, suddenly he falls on the ground, next scene, hospital, and he's alive. So the association is, next time when you see somebody falling on the ground, the only thing comes in the mind is, let me take to hospital. But the truth is, by taking to hospital, are you in real sense increasing his chances of reversal? It seems very obvious. Of course, by taking to hospital, I am helping him to revive or to live longer. It seems to be obvious. But what is the inside story? I'll tell one very simple. If the humans are in a problem, the one thing they do most of the time, we go to temple and then we pray and then we offer something to the temple. Do you think that money which we offer to the temple, that money goes to the god? Certainly not. Do you think because you have offered the money, you got a solution of the problem? Is there any connection between offering a money and a success? There is no. But still we do it. But in reality, rationally if you think, logically if you think, you know there is no connection between the amount of money which you give to the temple and the solving of the problem. There is no connection. I am not saying that you should not go to temple. I don't want to say that you don't pray. But I am just saying, is there any rational, is there any logic that if you give this much amount to the temple, only then you will get this much result? But the truth is, you know, there is no connection, but still we do it. Similarly, a person suffers heart attack or cardiac arrest. What are they? I'll tell you in the next 1 minute. But taking to the hospital, the chances of his revival, that is the most important question, because next time any one of us can be suffering from the same. Here, first I'll give the difference. What is heart attack? What is cardiac arrest? That is the first step. Heart attack is very simple. Death of some of the hearts. Attack is death of some heart cells. What is heart? Very simple. We know heart lies here and there are some cells as in other organ, and some of the cell dies, and when those cells die we get pain. When the cell here die we get pain. Wherever the cell will die we get pain. If the pain is in heart, so that is called heart attack. Simple. But what is cardiac arrest? Cardiac arrest is death. No pulse, no breathing, no response. Death. Right. So the film which you saw, that was cardiac arrest. No breathing, no pulse. So that should be called as death. You can call it death or you can call it cardiac arrest, same. Very important question. Death and cardiac arrest is same, because in death what happens? No pulse, no breathing, no response, right? Whenever you say he is dead, you can also say he is in cardiac arrest. Cardiac arrest. Heart is under arrest. Heart is not able to pump the blood, so there is no breathing, there is no pulse, obviously there is no response. So heart attack is death of some cells in the heart, and cardiac arrest is equal to death. This means one day we all are going to suffer from cardiac arrest. That is the truth. One more truth. When you die, we are going to die someday. So we can call that person has suffered from cardiac arrest. But that doesn't happen. If the person is already suffering from heart disease and now dying, then it is labeled, it is cardiac arrest. Person is suffering from cancer and then dying, labeled as died of cancer, right? So finally when the person dies, actually no response, no breathing, right? No pulse. So every time you die, whatever may be the reason, you die of cardiac arrest only, right? So you see, there is a cancer department, there is a heart department, respiratory department. But normally when I say cardiac arrest, what do you think it belongs to? Which of these departments? You relate with heart, isn't it? Cardiac arrest means something to do with heart. But the truth is, anyone or everyone, whenever you die, in reality, you are going to die of cardiac arrest, right? So that is the bigger confusion. So because of this confusion, the chance of survival has reduced to about 6% to 10%, right? So because of this confusion. So today we will talk of what is this confusion and how we can increase the chances. So here I would like to tell you one very important truth. I will show you in the that when you die, for first 10 minutes your death is temporary. This means it is not a permanent death. Only the breathing is lost, heart is not working, pulse is not there. In that 10 minutes there is a great amount of chances you can bring back the life, right? Whatever may be the reason of death, there is a chance that you can bring back the life. After 10 minutes death becomes permanent. There is a chances that you will not be able to bring back the life whatsoever you may do. First 10 minutes is important. In that first 10 minutes, the first 4 minutes is important. 4 minutes. Why? Because in first 4 minutes, the body is having enough oxygen for the brain to live. You are not breathing, you are dead. Or I am not breathing, I am dead. Let's say the dead body. But in the dead body also, there is enough oxygen for next 4 minutes. So this first 4 minutes after cardiac arrest is very important. Now if you say that I will take him to hospital, so what you are going to do? You are wasting these 4 minutes. Do you think that anywhere if he dies, even if he dies outside the hospital, can you take him to the emergency within 4 minutes? No. So the very thought, the first thing that I will take him to the hospital is going to kill him permanently. Permanently. So that is the most important thing. We'll come to that. So normally if you see, it is said that 10% death is because of cardiac arrest, but when they say like this, they refer to somebody is already having existing heart disease and now he is dying, so they take that only as a cardiac arrest, and rest of the death they do not consider as a cardiac arrest, and that is the thing. But otherwise, definition wise, clinically, cardiac arrest and death are same, right? Same. Now first, out of these two, I talked about arrest, I talked of heart attack. Which one is more dangerous? Yeah. So heart attack is not that much. So let me start with something simple first, right? What is heart attack and how we can we do something about it? Answer is yes. That's why we are here. What we can do? Let's say if you see somebody having heart attack, what is heart attack? If his heart cell is dead, that is heart attack. How you will know? You will know, he will report pain in these places, the red places. If he report pain in any of these places, there is a chances that he may be suffering from heart attack. I said he may be suffering from heart attack. I didn't say that he is suffering from heart attack. I try to understand, right? So how you recognize a person is suffering from heart attack? If he says lot of pain here, lot of pain here, the kind of pain that he is very difficult to bear with it. He's screaming with pain and he's referring to the pain and these places where you see the red mark. There is a chances that it can be heart attack. It may or may not be heart attack. If it is a heart attack, what to do? First of all, how to recognize, and if it is not, then what to do, right? So these are very, very important thing, but try to understand. If it happens at that time, you are not in hospital, right? And even if you take to hospital, what they are going to do, that also I am going to discuss, right? So not every chest pain is heart attack. Be very clear. If there is, you see, this is chest, but it is not only carrying heart, it's carrying so many other things also, isn't it? So if some pain happens here, that does not relate, it is not equal to heart attack. Every chest pain is not heart attack. Yes, some of them may be, not every, right? So if you understand this, then you will understand then that how critical or how important is this symptoms. So I'll give you some definition about heart disease and heart attack. First, I'll start with heart disease. Little bit anatomy you have to understand, only small, and then it will be very, very easy for you. What is the end result? Today, what you can expect out of these next 2 hours, you can expect that you will not fear heart attack, you will not fear chest pain, you will even not fear cardiac arrest. You will know that if it happens to somebody, what I have to do, but the important thing is, if it happens to you, then what? Do anything, isn't it? This means today, why I am teaching you? Because if it happens to me, then you will take care of me, right? So today I am in a little selfish mode. So I called all my friends, right? Surjit ji, etc., right? Yogesh ji, Mahesh ji, the people who are almost, my wife is there, right? So those people who are around me, I invited all of them, please come, right? So this is very important. Not only I expect that you learn it for yourself, but you have to really teach other people. Only then it can be applicable on you, right? And if you think that you are cardiac arrest proof, you understand? Like bulletproof. If you think that you are cardiac arrest proof, I can tell you, you are wrong. So the journey does not end here. It starts here, and it will end when you teach people around you what to do, right? So let me first teach you, and then you can do it. And here comes a little bit of anatomy which you have to understand. Now see, this is heart. Not a human heart, maybe a cow's heart of this size, right? But it is just to show you. Now, if you see, heart consists of, as you all know, there are 4 chambers, right? All, and 2 chambers at the top, 2 at the bottom, and then arteries are there. and atrium is there, ventricular is there. There are 4 valves are there. Now you see part, this you can say the wall of the heart. This wall can be sick. It can have an inflammation. It can have some kind of wound, internal wound. And if inflammation happens inside the wall, that is called heart disease. Will that give you a pain? What do you think? It will give you a pain. But that pain is coming from the heart, but that is not a heart attack. Coming from the heart, not heart attack. It can be called as endocarditis, myocarditis, pericarditis. There are so many names. But you focus on last. There is some inflammation. Endo is inside walls of inflammation, outside walls of inflammation. So, depending on. आप यहाँ पे देखिए, you just see here, the name are different, but the problem is same. Itis or tis or dis. These all means inflammation. Inflammation means Hindi में घाव, right? And whichever part it is of the heart, the first part of the disease relate to the location, and second part what is happening, arthritis. The same thing happens here in the joint, arthritis. Then comes otitis, right? So there are pancreatitis, gastritis means the same thing happens in the stomach, gastritis. So these are the things to confuse, but whatever may be the location, the end result is fatigue, breathless, weakness. Edema means, anybody? Swelling, right? So end result remain the same. If you see, there is a long list of disease, heart disease. Now you see mitral valve prolapse, mitral insufficiency, aortic insufficiency, then stenosis. This means this is something to do with the valves. There are 4 valves, and on that valve there can be some calcium deposit, stenosis, right? That valve may not be able to open and close properly, insufficiency. So if there is something to do with the valve, then according to that a name is given. But the important thing, you see, this side, that is left side, my left side is changing, but the right side remains the same. Did you notice this? Right? It remains the same. Whatever with the disease, the symptom remains the same. It doesn't change. The same discomfort. So if I change the slide, again the name of the disease changed, heart failure. Heart is not able to pump the desirable amount of blood, heart failure, right? So now cardiomyopathy, again it is related to this wall of the heart. Interesting one is Tekotsubo. Tekotsubo means broken heart. Somebody can die of broken heart. Means the somebody whose heart got broken because of some emotional problem. So at that time what happens, one of the chamber, the left ventricle, one of the chamber, it becomes like a pot. It becomes bigger like a pot, and that is called Tekotsubo. In Japan they use a small kind of pot, and that is to catch the octopus. So the shape of one of the chamber becomes similar to that, and that also gives all kind of symptoms, but that is not heart attack. It can be called heart disease, it is not heart attack, but it gives the same and similar symptoms of heart attack. It gives chest pain, it gives weakness, it gives fatigue, all the things. So out of all the disease which I have just shown you, one disease, that is coronary artery disease. And now here you can see there are some blood vessels. If you can see, can you see that? This blood vessel, if it gets blocked because of cholesterol or calcium or whatever, any kind of thing, then the blood flow towards that particular artery will not be there. This means the skin or the cells nearby, they will die. And the cells nearby will die, and that will give you pain. This is called heart attack. You see, you can get chest pain because of so many conditions, and all of the conditions related to heart only, but one of them may be called as heart attack. right? But now if you go to hospital with any of these conditions, most likely they will relate it with heart attack only, they will relate with coronary arteries disease only, because for this disease they have a huge business setup, angioplasty, angiography, right? So bypass surgery. So that is relevant for them, because relatively that is more paying. But the truth is, every pain may not be heart attack, or every pain may not be angina. Pain means when the pain is so extreme that it is very difficult for you to sit or stand, you are screaming. This means lot of cells in one part of the heart may be dying, or it can be inflammation, or it can be valve problem, or it can be something else, or it can be, yes, some of the cells dies. So here you see there are so many ways your heart may not work properly, and out of that one is the case where you can say truly it is heart attack. So the chances of this happening is not that much as we expect it to happen, right? So yeah, so you may be suffering from heart disease, but that disease should not be called as heart attack. You may be having the symptom of heart attack, but that may not be actually heart attack. This is one part of it. And second part, chest pain can be because of this outer wall, chest wall, there can be some inflammation, and even that can cause the symptom similar to heart attack. Or the most important thing, gastroesophageal reflex disease. This means the pain is from the stomach. The food which we eat, there is a food pipe, and in the food pipe there is a valve. That valve stops the food from coming up. But sometimes the kind of food which we are eating, even that valve is not able to block. For example, if I close the door, people will not be able to enter. But somebody, if they push hard the door may break, or door may still open, and the person can enter. The same thing happens to the the esophageal valve. Normally the food, it can stop, but sometimes the kind of food which we eat, this valve is not able to stop, then the food comes out here, and when the food travels back through the food pipe, that gives the same kind of feeling, same kind of pain, same kind of symptom as of heart attack. And in panic, you are taken to the hospital, and I can tell you one very important thing. There is no way to know truly whether it is a heart attack or not. I'll come to that. So, but they guess, and mostly you'll see doctor comes out within 10 minutes and say he can survive only if we do angioplasty right now. And then we do not have any choice, and we say, okay, do anything, but he should be saved. I'll come to that part. But here I want to tell you that these are the non-heart cause of chest pain or heart attack similar symptom. For example, sometime if you are in anxiety, if you are in stress, only stress can cause you the same symptom as of heart attack. Stress. This means your body is perfect, your heart is perfect, everything is perfect. Extreme stress can also, extreme emotional turmoil can also give you the feeling of heart attack. Even pneumonia, lung disorder can also cause the same kind of symptoms, same kind of pain which you cannot distinguish. Nobody on earth can distinguish from heart attack. So this means, because of what I believe, Hollywood heart attack or Bollywood heart attack, we have understood that if there is a heart attack, the only thing is that I'm going to die, take me to hospital. But there are a lot of ways you can have the same symptom which otherwise you may confuse as a heart attack. Now, assuming you have a pain right now, what are the steps we must do and what are the steps we must avoid? Let's come to the point. You see, in any hospital on average, if 100 people visit hospital for various purpose, 1% out for every 100 people visiting hospital, 1% of them visit hospital for chest pain, heart attack kind of pain. And out of those people, for every 100 people or every 200 people visiting the hospital for chest pain, about 2 or 3 people are suffering from a real heart attack kind of situation. So this comes out to be, imagine 20,000 people, they report to the hospital because of extreme chest pain. This means out of those 20,000, in reality, 300 will have the real heart attack, and out of those 300, in reality, 30 are going to die. That is 10%. Right? So this means out of 20,000 people, suspected heart attack people, suspected means they are assuming it is heart attack. 20,000. How many are going to die in reality? Only 30. Only 30. That is equivalent to 0.15% of the chest pain patient die. 0.15. Do we need to worry? I'll give you next slide. In India, 15.5% people die of diarrhea. So last time when you had diarrhea, did you think that I will die? No. So when you have diarrhea, when you have loose motion, if at that time you are not worrying about your death, then if you have chest pain, why need to worry or why need to panic? Right? Diarrhea 15.5%. Thank you. And chest pain converting into real death, 0.15%. It is not the problem is not the chest pain. The problem is the fear factor. The fear. Here there is no fear, right? Because diarrhea is not perceived as a lethal or dangerous situation. But the truth is more people die of diarrhea in comparison to chest pain. That you have to understand. So here, till now what I talked is what is heart attack or what is chest pain or what is the symptom and what can be the causes. There can be heart causes, there can be non-heart causes. There can be really, one can die, but the possibility is very, very less, very less.